Okay.
Okay, go.
Howdy, I'm Bailey Roemer,
Howdy, I'm Brittlynn Allen.
and we are Group 7, and our clinical correlation is the eyes. So how the eye works. The eye consists of 3 significant layers that work together to create structure, supply fluids and blood vessels, and produce a visual of the environment around us. You can look at the picture at the bottom right corner and just see all the different types of eyes. Now we're going to talk about the 3 layers. The first layer is a supporting layer, and this focuses on structure. The majority of this layer is the sclera, which is recognized as the whites of the eye, and the cornea is located at the most anterior or frontal plane, which is an avascular tissue that light must pass through. It also has to be clear in order to produce a sharp image. And you can look at the top image and see that the section labeled A, you can see the cornea in the front anterior side, and the sclera, which surrounds the whole eye. The second layer is composed of the choroid layer that supplies blood vessels throughout the eye. This layer is the vascular layer, so blood vessels is a part of it. The ciliary bodies and processes alter the shape of the lens or the part of the eye used for the adjustment of near and far vision through filamentous zonules found in aqueous humor secretions. The last component of the vascular layer is the iris. This is the colored part of the eye that has constrictor dilator muscles to control the amount of light which passes through. You can see in the top image again, section B, you can see the iris and its muscles and the ciliary bodies that secrete the aqueous humor and help to change the shape of the lens. The last layer is the retinal layer. This is the layer we're going to mainly focus on in this presentation, and it consists of the retina. With a total of 4 layers, the retina can be described as the complex layer of tissue that is intertwined with ganglion nerve cells, rows of rods and cones that decode light, dark, and color stimuli respectively, and a pigmented epithelium that works to absorb as much light as possible for further visual construction. And you can see in the last part of the top image, section C, you can see the different types, layers of the epithelium and of the retina. Okay. So our first disease is amblyopia. And if you look in the picture, this is the blind spot located in the back of the eye in which the optic nerve enters into the retina. Okay. Amblyopia is a common disease that leads to premature vision loss in primarily children since it occurs during the developing stage of life. By looking at the picture, you can see how one eye is looking alert and centered, while the other appears to be inattentive and lazy, in other words. Okay. Because of this, parents have to be aware of this disease because it's often looked over since the symptoms include squinting, closing of one eye, and the tilting of the head, which are common things seen in children. Though it's unclear what the initial cause is, amblyopia occurs when one of the optic nerves, one being in each eye, is damaged by a dysfunction in the brain. As labeled, the optic nerve receives all of the signals from the brain for the eye to function properly. But if amblyopia makes vision in one eye worse, the brain may find a way around it. That is, the brain will simply focus on one eye over the other, creating an asynchronous system. And you can see the picture of the optic nerve. As noted before, these common symptoms should be picked up on by parents because it could be a sign that a child's visual signals are being disrupted. Mostly children who fall below the curve of health can become susceptible to amblyopia because their brain cannot function at the highest percentage. So premature, abnormally small, and disabled babies are at risk. It's also important to note that it is a heritable disease that can be passed down through generations. Another thing to point out is that amblyopia is associated with the condition of cataracts. And you can see the picture there. It is essential to diagnose this disease in children as soon as possible to increase the chance of recovery before the child reaches maturity. During treatment, the common practices focuses on strengthening the weaker eye by either completely blocking the stronger eye from signal receptions through the use of eye patches, or by applying atropine eye drops to the stronger eye, making the favored eye blurry and therefore less favored. All in all, these treatments work to give the weaker eye a chance to strengthen in the spotlight. Okay.
Our next disease is wet AMD, which stands for wet age-related macular degeneration. So what is wet AMD? Wet AMD is a chronic eye disorder that has symptoms that can worsen very, very rapidly, which is why it's important to get the diagnosis as soon as possible. It is also a leading cause of vision loss in people who are aged 50 years and older. But if it is caught early, the symptoms can be managed and vision can be improved by an ophthalmologist. So symptoms and causes of wet AMD. Wet AMD will develop when the blood vessels that are underneath the macula, showed in the picture over here. The macula is the part of the eye that will control the central vision and detail. So the macula is going to control those things. So the wet AMD is going to affect the way someone sees. The blood vessels will leak blood and fluid behind the eye, which will then scar the macula, causing the wet AMD. Most symptoms include blurred vision, wavy lines, dull colors, or blind spots. These will be shown in the next slide. Blurred vision, wavy line, and blind spots are all kind of put together in a picture in the bottom. As you can see, there are a blind spot in the middle, everything's blurry, and things are looking a little wavy at the top with the fence. This is caused by wet AMD. When getting a diagnosis, you want to get this diagnosis from a doctor who's an eye doctor, and those are known as ophthalmologists. They will link the symptoms that you have to wet AMD, and then they will do tests to observe the eye function and see the vision and how the macula is damaged. Once they do that, they can go to treatment, which they use a drug called EYLEA or EYLEA. And this is a shot that is put directly into the eye. You can see in the top image, there's an ophthalmologist looking at a man's eyes. And in the bottom image is the drug that is administered to people with wet AMD. So for amblyopia and wet AMD, we have a few questions. So our first test question is, which of the following layers of the eye matches respectively with the above image and is responsible for supplying blood vessels and altering the shape of the eye to maintain the amount of light which passes through? The answers are A, supporting layer, B, vascular layer, C, vascular layer, D, A and B, E, A, B, and C. Let y'all think about that one for a second. And the answer is B, the vascular layer. The vascular layer. In the little bubble, it says this includes the choroid, ciliary body / processes, and the iris. You can see in the picture where the vascular layer is and where the ciliary bodies and the iris is. Question 2. Amblyopia, commonly known as lazy eye, is a disorder that occurs when one of the optic nerves is damaged by a dysfunction in the brain, causing the brain to favor one eye over another. This disease leads to many symptoms, which include squinting, closing of one eye strain, A and B, or A, B, and C. Okay. The answer is D, A and B. Squinting, closing of one eye, and tilting of the head are all common symptoms, but eye strain is a problem due to the overuse of eyes. So eye strain is not going to be one, but squinting and closing of one eye will. Test question number 3. What age-related macular degeneration is a chronic eye disorder that causes blood vessels from the choroid to leak into which key component of the eye responsible for the eye's central vision and detail processes? A, macula, B, cornea, C, iris, D, A and B, E, A, B, and C. We can look at those pictures and try to remember which part of the eye is damaged. And the answer is A, the macula. Wet AMD stands for wet age-related macular degeneration, which should have been a big giveaway to which part of the eye is damaged. And then our works cited. Thank y'all so much.
Thank you.